Thank you very much, and thanks to everybody for coming, and to ODI for hosting this launch, and get the chance to thank Andy in person, not only for the hosting this event, but for all the guidance and support that you gave as a peer reviewer for this work. So you kindly introduced me as the lead author, but I do want to recognize my co-authors, Alec Ahala, Maggie Kojal, and Santosh Srinivasan, some of whom may be online, I don't know, but they also were core to this project. And also Chris Stolk, who's here in the room, was from RAND, contributed some of the background material on grievance redress, and I'm really glad you're here. I can lob all the tough grievance questions to you. Last thank yous go to the Governance Partnership Facility, which is helping support this launch and also supported some of the background work, and also the Nordic Trust Fund for Human Rights, which is hosted at the bank, also helped with some of the background work on right to information. So I'm going to take you through the report and hopefully interest you enough to read it further. So I think Ariel did a great job sort of giving the background on why we did this work, and it really did start out as sort of a stock taking both of the World Bank project experience, but also of the evaluation, the body of evaluations that are emerging in this area. But I think it's important to note that this misses a huge amount of work that's done by others. We started this as sort of an internal stock taking, but we know that there is a lot of important experimentation and work being done by others in this area, which would be sort of a next stage of work to learn from that. And so I'll just take you through some of the concepts and then some of the experiences we looked at and some thoughts for the future. And I think, the punchline that my personal takeaway is cautious optimism. So I'll just throw that out as the direction we're going. So in terms of why we did this work, I think the concern about social accountability, as Ariel mentioned, is driven from a number of directions, and primarily from where we sit about thinking through how to remedy some of the serious failures of service delivery. And so there's been increasing evidence from absenteeism surveys, from public expenditure tracking surveys, from other analytical work about, in some countries, absenteeism of teacher, leakage of public funds in health and social protection, shortages and stockouts of key medicines, missing textbooks, et cetera. And so social accountability is looked to as one of the approaches for improving the quality of service delivery. So relationship with results, improving results, improving value for money of government, but also donor resources, and involvement of civil society and even the media in addressing some of these failures. And also some optimism on the potential use of information technology. There's sort of all sorts of websites like Check My School and other sort of innovative approaches to involving citizens in service delivery through technology. So as Ariel mentioned, the sort of conceptual starting point that we use for this, which I know is familiar to a number of people in the room, is the 2004 World Development Report, which talked about a accountability triangle of relationships between citizens, policymakers, and providers. And so really talking about two mechanisms or routes to accountability. First, a long route through which citizens can elect policymakers who then can influence providers, and then a short route, which is really where we're focusing today, in which citizens can influence providers directly. And just a note about terminology, we talk about citizens, it's on the cover of the report, but it's not to mean in sort of an exclusive definition of citizens. I mean, this is not about sort of some people being more able or involved in service delivery. I mean, it's a broad term, so we're talking about the clients of of services. And then on the provider front, it's providers both being the frontline providers, teachers, doctors, but also the program managers, the facilities managers, et cetera. So that's what we have in mind. So I think there's some, assumptions to be transparent about. So with social accountability, I think it boils down to the idea that people can use information to hold providers accountable. And so this requires sort of two key things: information, the sort of information for transparency, and then opportunities, the channels to use information to bring about change. So that goes through participation and redress. And looking through, we did a stock-taking exercise, which I'll talk about later in the presentation, of about over 400 World Bank projects, and sort of grouped by categories, and we see sort of two big clusters around providing access to information, and then grievance redress, which is opportunities to use information. So access to information could be anything from passing a law, so active access to information laws, which I'll talk about, to information campaigns, and they come in various forms and have various focuses. But then within information campaigns, there can be sort of passive providing information, but then also active engagement of citizens around information, and that can come in the form of scorecards and social audits, which I'm sure many of you are familiar with. On the channels to use information, we look at grievance redress, and here, the idea is how can citizens actually use information to sort of demand for their rights and to redress when things go wrong. And we see sort of three broad types. One is line ministries and providers can set up hotlines and other complaints handling mechanisms. NGOs, independent agencies within government, can set up sort of independent functions for redress, and then you have the court system. And we see across a number of countries a real interesting emergence of courts as active players in redress in the social sectors. So looking more at the assumptions along the short route, I think there's a really interesting discussion in the paper that sort of tries to pick this apart, right? So on the triangle, it looks very simple: citizens can influence provider. But when you look at it and break it down, it gets interesting. So, first assumption is that people have the ability and incentives to access information and to use it. And here, I think a number of things emerge. The social sectors, I think, are a very relevant place to think about social accountability, because it involves frequent engagement between providers and citizens. But on the other hand, there's a lot about healthcare or about education, which is technical, and there's information asymmetries, and people may not have the information to judge whether a doctor is a quality one or not. It's kind of like going to the car mechanic. You just have to take certain things for granted, and that has implications for the extent to which people can access information and process it. And they also may have other priorities in information, and here sort of literature from behavioral economics is really interesting. There's work, for example, by Sendil Mulanathan and others that looks at people's, he talks about attention span, and he did surveys or experiments with poor farmers and their cognitive abilities, and found that cognitive ability goes down during a harvest. So when people are busy, it crowds out their ability to think about other things. So the assumption that people can just sit around and absorb and use information, perhaps we need to think about that. The second big assumption is that people have the willingness or the ability to actually use information to influence providers. And here, I think a lot of perhaps political, cultural, other factors come into play. We did, there was a survey of quality of medical care in India, which found that patients were basically not asking questions when they went to the doctor, and this may be because they don't feel like they're in any position to ask questions of somebody who's of higher status or has more information about something than they do. And then the last one being that providers will respond. And I think this one we'll talk about as I go through some of the examples, but again, it's I think the conclusion here is that behaviors and incentives are embedded in a complex set of a context, which information and social accountability is just one factor coming into play in the way in which providers behave. So I'll just go through, in the time I have, a few examples in each of these sort of blocks that I mentioned. So starting with the information interventions, I mean, access to information laws, which provide the legal framework, have really been taking off. And so, we did a sort of stock take and found that, the number has really taken off. You have over 80 countries which have specific access to information laws. Quite a number of countries have access to information as part of their constitutions, but when you look under the sort of skin of it, these are largely general and not sector specific. So when thinking about what does this mean for a health sector, what does this mean for education, et cetera, it's not so obvious. And this is also an area where, because a lot of these laws are new, there hasn't been a lot of sort of evaluation or assessment of experience. India is probably the richest experience. They adopted their Right to Information Act in 2005, and it's really sort of taking off. The numbers, 2 million requests for information in the first 2.5 years seem quite big, though, we don't have a benchmark, so what does that mean? So I think thinking through, what is the impact? What are people asking about? Who has access? I mean, we find that there's, among poor households, lower awareness, among women, lower awareness, and what is the impact? And here's, I think, a body of work that's yet to be done on what does this actually mean, and what are people asking about, and what does it, to what end? And there's a really interesting evaluation that we cite in the review, which found that for the PDS food distribution program, they did a randomized experiment and found that filing an information request to follow up on your application was no more effective in speeding up the process than paying a bribe. So I think that's an area for further analysis. Then information campaigns, and sort of broadly speaking, there's sort of two buckets of information that the campaigns that we looked at provide. One is about the content of services, including people's rights and the standards they should expect, how much money should be spent, and how services are organized. So whether there's a school committee, a parent-teacher organization, and what are the channels for participation. And then second, about information related to the quality and performance of service providers. And we go through a number of different examples. And India is a sort of one of the countries where there's been perhaps the most experimentation and innovation, and there's contrasting results in the examples that we find. So one set of evaluations was done by Priyanka Pandey and colleagues, and involved informing both the community and teachers about the education services and about the roles of village education committees, and looked at 3 different states, Uttar Pradesh, Madhya Pradesh, and Karnataka. Learning outcomes increased in all cases, but there was real diversity in terms of the impact that these campaigns had on provider behavior, meaning teacher attendance, the amount of time they spent on teaching activities, and then the rate of parental involvement. And then complemented by this, there's another study by Banerjee and colleagues, which had a similar effort to inform people about the roles of village education committees, and it had no detectable effect on outcomes. So I think one of the things that emerges is that there's a lot of heterogeneity, and the pathways through which these types of information campaigns are complex and difficult to evaluate. I think another theme that cuts through the study is the challenge of evaluating these types of interventions. There's a lot going on. There's with information campaigns, potential demand effects. Maybe parents, when they hear about certain aspects of education or of healthcare, became more interested in and are sending their kids to school or getting more involved in education. So there's a difficulty of disentangling effects, and my colleague, co-author Alika Hala helped with an annex on specifically on this question of the challenge of evaluation in this area, which we hope will be useful in thinking through how these types of interventions can be evaluated more effectively in the future. On the health side, an interesting example of a information campaign in China, which provided patients with information about the efficacy of antibiotics, and found that when patients who knew what the role of antibiotics were went and talked to doctors, they did a simulated sort of fake patient exercise, doctors were less likely to prescribe antibiotics, and healthcare costs went down. So the idea that informed citizens changed provider behavior in that case. Another education example that is quite interesting is work by my colleague Jishnu Das and others in Pakistan, which provided information in the form of a report card to parents and schools about the performance, about learning outcomes in different subjects. And it was a very interesting context in that there were a lot of private schools and a lot of schools in general, so something like 7 schools per village. And so they found that this kind of information improved test scores, so providing this information to the communities improved the test scores, especially for private schools that were sort of below average, and for higher performing schools, they reduced their fees. Sorry, I should have shown you this slide earlier, but the idea there being that giving people information, giving the schools information about relative standing in a market caused them to become more competitive, that parents perhaps were demanding quality improvements, and that benchmarking can actually also affect the ways in which schools perform. And as I mentioned, I think I mentioned the Banerjee study already, that there's a lot of diversity and the evidence is mixed. The example that I have on the slide of work in Benin of community radio, they found improvements in learning outcomes, but not on provider behavior. So again, perhaps a demand effect, but not so much on provider effort. Moving from information campaigns to this sort of more active scorecards and social audits, these types of exercise, again, they're diverse in the way they appear, and I'm sure that there's people in this room who have experience in the field and working on these types of interventions. But the idea is not just giving people information about performance or about this service delivery, but actually facilitating discussions then between citizens and providers. And using that to come up with action plans and ways in which services can be improved. And this is an area where I think there's a lot of activity. We found in our review of the World Bank projects that there's, quite a bit in the pipeline. I think we found 8 different projects with health scorecards that are coming out, but a limited body of evidence and experience to sort of guide the way forward. In the social protection area, the NREGA workfare program in India has a social audit component, particularly in Andhra Pradesh, which is getting a lot of attention and provides citizens with the opportunity to sort of match their experience with the program to sort of the budget and outcome results. And that's been shown to have increased awareness of the program, though evaluations, I think, on that are forthcoming, and it will probably be a really rich source of information. Health scorecards, this work by Bjorkman and Svensson, I think is quite well known, where there was a a scorecard effort that improved infant mortality outcomes by quite a significant amount, and also affected provider behavior as measured by absenteeism and waiting times. So that's probably the best known evaluation of scorecards. So looking at what works, I think the short answer is that we still need to look and evaluate to sort of distill concrete lessons, but I think some ideas emerge. One is on message framing, and here again the sort of psychology and behavioral economics literature can be an interesting way to think about how people process information. There was a study by Justine Hastings and others in schools in North Carolina where parents were given differing amounts of information about school performance and different, one was a 100-page booklet, another was a 3-page booklet, a 1-page booklet, and people were, I guess unsurprisingly, better able to process and use information when it was provided to them in a more concise way. Method of delivery, so what kind of tools are used and who sort of structures and manages face-to-face meetings, for example, in communities can make a difference. There's work in Indonesia around the targeting of social assistance that looked at who is inviting people to community meetings, and again, sort of going to the contextual factors. It may those small design details may have quite a difference on who participates, who's included, who's excluded, and I think points to some interesting and important things for those of us involved in donor activities to think about in terms of design. And lastly, I mean, again, these are not unsurprising points, but the message clarity and the sort of presentation of information makes a big difference. One of our colleagues told us about a very well-intentioned attempt at putting report cards into use in schools in Cambodia, which just fell flat because they were designed by someone who didn't know the context, they were in the wrong language, there was information that parents couldn't process, and so even sort of basic design details can make a big difference. So now, turning to grievance redress, I think this is a fascinating area and one of the areas where we felt in the portfolio review there was sort of growing interest and involvement, but it's also very difficult from a sort of evaluation and experience perspective, difficult to get information because there is a diversity of approaches and not a lot of knowledge yet. So here we talk about grievance redress mechanisms being the formal and informal channels that citizens use to express their satisfaction or dissatisfaction with service delivery, and the idea being that these are primarily last resort channels, so when things go wrong, grievance redress comes into play. And I mentioned the 3 different types within government agencies, the independent redress institutions and courts. This is data that you can't see the countries, but comes from the Life and Transition survey that the World Bank has worked on with the EBRD. This survey, I think, just came out over the last few months of 30 or something countries in the Europe Central Asia region, and they asked, I think this is one of the first surveys that asks people across countries whether people file complaints in education and health. And I think what's interesting for me about this data, first, is that it's collected, and second is what it sort of prompts in terms of, how do we interpret this? And I think the answer is, we don't know much about how to interpret this. I mean, on the one hand, you see countries like Sweden and Germany and Great Britain where people are more likely to file complaints. On the other hand, poorer countries, Tajikistan, Kyrgyzstan, the stands, countries in Central Europe aren't complaining so much. But what do we make about that? Does that mean that systems are better? Does that mean that people have more access to voice? Does that mean people are more encouraged? They know more about these grievance mechanisms? So I think it prompts prompts interesting questions that we need to dig under the skin of. What does grievance redress actually mean in the human development sector? So I think going through the review of examples and the portfolio review, we sort of came up with maybe three sort of caricatures of how this looks in the three subsectors. So social protection was probably the area where we found the most use of grievance redress mechanism, but also in World Bank projects. And this is because complaints handling is used to manage targeting of cash transfers. So a lot of the Latin American countries in particular that have big conditional cash transfer programs are actively using complaints handling as a way to improve their targeting. So Bolsa Familia, for example, in Brazil, my colleague Benedict is here and she could probably talk about this more in detail, but they have a multi-layered, multi-level complaints handling process, which ranges from the central down to the municipal level, and people have multiple ways in which they can register their complaints, and you see similar types of redress mechanisms and other cash transfer programs. I think another thing that's sort of been pioneering about these in social protection is the extent to which they're being integrated into information technology systems and sort of becoming part of the information technology backbone of programs. In health, there's probably
Dena?
Yeah, sorry,
5 minutes from this
perfect,
point.
I can do it. Just talk faster now. So in health, there's agency level complaints handling systems. So for example, in the UK NHS, you can file complaints at the hospital level. You can also file complaints to an independent body. New Zealand has set up a commissioner for managing complaints in health, and in quite a number of countries, courts are picking up an important role. So in Colombia and in Brazil, there are hundreds of thousands of cases that are being filed by individuals to access medications and health care, and it raises a lot of issues about who has access and how it shapes the way in which the health systems respond. And in education, we found fewer, and this may be our sense is, but we need to do more work, is that people tend to resolve complaints at the school level. There's more mechanisms perhaps for participation, so people can bring up complaints directly with headmasters or school boards. And school-based management is also an important channel for resolving complaints. So just a few words before I get to some summary points about the project review. As I said, we did a keyword analysis. I can talk about it in more detail maybe in the questions of projects, and found that of our 427 projects, ignore the bottom numbers because I think they were from an old slide, but we found about 380 made some reference to social accountability in the areas that I have mentioned, but really a small short list of 38 projects actually included sort of financing of social accountability mechanisms, so technical assistance to run an information campaign or set up a grievance redress mechanism. So there's sort of a big range in the extent to which projects actually invest in these mechanisms. And the sort of distribution, I don't know if the colors show up on the chart, but on the left, basically it's social protection that has the greatest number of social accountability mechanisms, and information campaigns and grievance redress are those that are most prevalent. So I'm glad to talk more about the portfolio review, but I want to get to a couple of summary points and then the discussants' comments. So I think the bottom line is, as I said, cautious optimism. This is an area where there's a lot of excitement, a lot of innovation, but I think what we found in the review is that it's not straightforward. The sort of short route is not a direct one, and social accountability tools can be effective, but perhaps within a broader context of mechanisms to influence provider behavior, change incentives, etc. I didn't talk about it much, but I think a number of the examples also point to important roles for intermediaries, such as civil society organizations and media, to facilitate access to information and redress. So the whole use of access to information legislation in India, for example, civil society is providing an important role in informing people about the channels they can use and how to file a request and how to follow up. Similarly, with grievance redress, even in the UK, there's citizens advocacy organizations that help people access redress. And then the design is really important. I talked about some of the issues that came up in the discussion of design of information campaigns. And technology is an important piece of the design, but it's not a panacea. These interventions take place within a program context, and so just introducing a mobile phone intervention, et cetera, doesn't necessarily mean it's going to work. So looking ahead, I think the message is clear on the need for investing in more evaluation and learning. There's a lot of pilot experience, but it's not clear to what extent those pilots can lead to sort of scaled up sustainable initiatives, and their interaction between social accountability mechanisms and policy. I think there's a lot of opportunity there to think about how social accountability can be a systemic part of a monitoring and accountability system within a sector. And then the need to focus on the cost effectiveness side. And Chris is nodding. This is something that we really tried to dig to find information on cost effectiveness, and it's hard to make sense of. So for the World Bank and other donors, implementation and supporting implementation through how-to guides, and both on how to make these things work and how to design better evaluations is key. And as I said, we started by looking at the World Bank portfolio, but we know that there's a lot more that can be learned by looking outside, and a lot of opportunity to work on this together. So thank you very much.
Thank you very much indeed, Dena. Yes, there are seats further down towards the front as well if you'd like to come down. Thank you very much. Just to clarify, this wasn't entirely based on World Bank information, was it?
No, I meant the portfolio review.
Yeah, the portfolio review.
Portfolio review.
But you were looking at outside experience as well as World Bank projects.
Right, but what I wanted to make clear is we did not do a stock taking of partner initiatives, which we recognize as a rich source.
Yeah, that was great. Thank you very much indeed, Dena. I think it's a really important piece of work. My main question, just listening to you, coming back to this, was about where the politics fits in terms of broader power relations outside the sector and how those condition whether given tools, whether given approaches will work. But I'm sure that is something that both our discussants are likely to take up.